Okay, today we will proceed with about 5 cases on urinary tract infection. So the first one says a 25-year-old woman presents to your clinic with 2-day history of dysuria, urinary frequency, and suprapubic discomfort. She denies fever, flank pain, or vaginal discharge. She is sexually active and uses spermicide condoms. Examination is unremarkable. So, what is the most appropriate next step in the management? A. Urinalysis and wait for results before treatment. B. Empiric antibiotic therapy. C. Pelvic ultrasound. D. Refer to urology. E. Prescribe antifungal therapy. So our evidence here is our evidence for urinary tract infection here is so she has dysuria, urinary frequency, and suprapubic discomfort. Okay, but she denies no fever, any flank pain, or any vaginal discharge. But very important point is she is sexually active and she uses spermicide condom as a contraceptive. So, being using spermicide condom and being sexually active is a risk factor for this woman for urinary tract infection, and the signs and symptoms being is dysuria and urinary frequency with suprapubic tenderness or with suprapubic discomfort. Therefore, provided that she has an evidence for urinary tract infection, the most effective next step in management is it says urinalysis and wait for a result before treatment. No, we shouldn't wait for any treatment before. Ndom, we have to start with empirical antibiotic therapy. Okay, empirical antibiotic therapy, and after that, we might taper our antibiotic regimen based on the culture result and others ማለት ነው. That is the best one. So we have to give an empirical antibiotic therapy, then we might send culture. But urine culture send የምናደርግበት ኢንዲኬሽኖች አሉ። Yeah, this is our first episode. So urine culture is sent for recurrent urinary tract infection. What's recurrent urinary tract infection? Recurrent UTI የምንለው when there is okay greater than or equals to 2 episodes okay over 6 months or greater than or equals to 3 episodes of urinary tract infections over a year. Recurrent UTI. So for such kinds of cases, it warrants urine culture. But for this case with no any recurrence feature, just treat with empirical antibiotic therapy. Pelvic ultrasound, that's own indication for those with again recurrent UTI with susceptible structural abnormality, urinary tract abnormalities. Okay, you might consider pelvic ultrasound and refer to urologist. This is not a referral for urology. So referral for urology again if there is known structural defect with this imaging, ultrasound or with CT scan. If you find a urological urinary tract defects or abnormalities, then you will refer her for urologist. Okay, prescribe antifungal therapy now. Antifungal therapies, these are indicated for some cases okay associated with fungal urinary tract infection. So for example, fungal urinary tract infection is one of the differential for sterile pyuria. Okay, you know sterile pyuria, it is one of the differential for sterile pyuria. So the first one is TB, okay, urinary tract TB. 2, fungal infection of urinary tract. 3, diabetic nephropathies. So this sterile pyuria, so for that case, if you confirm that with culture, if it develops or if it grows fungus, then you will go for antifungal therapy. So our appropriate answer is empirical antibiotic therapy. So what are these antibiotic regimens? So for this case is normally urinary tract infection, but uncomplicated urinary tract infection in adult female. So generally divide as urinary tract infection into 2 as complicated, uncomplicated, and complicated UTI ብለን እንከፍላለን ማለት ነው። So uncomplicated and complicated UTI, it doesn't mean that the complication risk okay, rather than the possible risk factor, the underlying risk factor ነው የሚሰራው። For example, complicated UTI የምንላቸው those who are in immunocompromised, for example, okay, immunosuppressed or immunocompromised የምንላቸው, those who are diabetic patients, those who are HIV patients, okay, those who are on chemotherapeutic drugs, okay, chemotherapeutic drugs ላይ ያሉ ሰዎች, okay, and also being male, okay, being male patient is also a risk, okay, a risk factor for complicated urinary tract infections. That is complicated የምንለው ያ ነው, and so on and so forth. But uncomplicated, without such kinds of risks, without such kinds of risks, that means no risk factor is identified. No risk factor identified. And most commonly is females. Okay, females are the most common sex category for more common sex category as compared to male for uncomplicated urinary tract infection ማለት ነው. So for those with uncomplicated UTI, our first line drugs, okay, on depending on our guideline, okay, is the fluoroquinolones. For example, the ciprofloxacin, okay, ciprofloxacin 250 up to 500 milligram, okay, PO BID for 3 days, okay, for a complicated. Or you can go for norfloxacin, again 400 milligram BID base for 3 days again. Or you can go for nitrofurantoin, okay, nitrofurantoin 50 milligram, okay, nitrofurantoin 50 milligram, BID base, okay, for again 3 days, for 5 days, okay, yeah. So alternative for this, or if there is contraindication for these drugs, then you will go for other drugs. You will go for other drugs like for augmentins, okay, you will go for augmentin, okay, or you will go for cefixime, okay, augmentin or cefixime or other third generation PO antibiotics consider ማድረግ እንችላለን። Also cotrimazole might be also tried, but for those with risk of resistance is less than 20% ላለው group of population ነው recommend የምናደርገው ማለት ነው። So እነኚህን አንቲባዮቲኮች ትራይ እናደርግላታለን ማለት ነው። So what if she is pregnant? We will come on that. The second question, a 32-year-old woman presents with fever of 38.7 degrees Celsius and right flank pain, nausea, and urinary frequency. On exam, she has right costovertebral angle tenderness. So she is very febrile, she has right flank pain, and she is nauseating, and she has urinary frequency. On exam, she has CVAT positive. So probably she has pyelonephritis feature. What is the best initial management? Oral nitrofurantoin? No. So this is pyelonephritis by definition. It is okay, more of the severe form, okay, upper urinary tract infection. No matter. So oral nitrofurantoin doesn't fit with that. Immediate referral for nephrologist? No. Start IV fluid, okay, start IV fluid and IV antibiotic. This is the correct one, okay, IV fluid and IV antibiotics. And CT abdomen? No. Okay, this is not the urgent, but this is gold standard, okay. This is gold standard for the diagnosis of urinary tract infection. Gold standard for the diagnosis of urinary tract. But this is not the first investigation. The first investigation should be X-ray to look for some kinds of, okay, stone like radulation stone. So, and it will be followed with ultrasound to look for any functional or some kind of structural abnormality ካለ ለማየት ነው። Urine dipstick only? Not, okay, not. So you will go for, so this is a case of upper urinary tract infection, probably with pyelonephritis. So this is women with pyelonephritis feature, so septic feature. So therefore we should have to treat it with IV antibiotic. Otherwise she may go with a urosepsis or sepsis of genitourinary focus ይሆናታል ማለት ነው። Therefore this is actually this is not complicated case, but rather it is this is not complicated case, but rather this is risk of urosepsis will be high, so she didn't tolerate PO, so we should consider, so our diagnosis first, this will be pyelonephritis, okay, upper urinary tract infection or acute pyelonephritis, okay, with probably with PO intolerance. So on that cases, we should consider IV antibiotics. Okay, IV antibiotics. So first line will be, you should have to the first line, if ciprofloxacin, if ciprofloxacin 400 milligram IV ካለ we will go proceed with that. Okay, on a BID basis መስጠት እንችላለን ማለት ነው። then በሱ ሰጥተን then we will change it into, after 72 hours of improvement, we will change it into the PO. Okay, with PO ciprofloxacin መቀየር እንችላለን, with PO cipro or with PO cefixime መቀየር እንችላለን. or if it is not available, you will go for ceftriaxone. Okay, ceftriaxone መቀየር እንችላለን። ceftriaxone 1 gram, okay, or 2 gram, 1 gram or 2 gram IV daily አድርገን, okay, and again we will adjunct if there is improvement, and like we will give it for 5 days after admission. 5 days of admission is enough, or 3 to 5 days of admission is enough, and we will change it into the cefixime or ciprofloxacin አድርገን for complete, okay, for complete 10 to 14 days መስጠት ይጠበቅብናል ማለት ነው። for complete 10 to 14 days. So we will treat it like a complicated urinary tract infection ነው የምናከማቸው ማለት ነው። በዚህ ፎርም ማየት እንችላለን ማለት ነው። The third question, a 52-year-old postmenopausal woman, this is postmenopausal woman, reports 4 urinary tract infections in the last 6 months. So this is recurrent UTI ማለት ነው, recurrent UTI, and she is concerned about recurrence, and she has no urinary incontinence or hematuria. Which intervention is most appropriate to reduce recurrence? A, vaginal estrogen. B, cranberry juice, long-term IV antibiotic, avoid intercourse, daily oral prednisolone. Okay, so she is postmenopausal woman, and the most common predisposing factor for recurrence of urinary tract infection is vaginal dryness. Okay, is vaginal dryness. So this vaginal dryness should be, they may come with a recurrent UTI feature. Okay, but despite there might not be any kinds of bacterial development, okay, or bacterial colonization, but simply the dryness feature may also appear or may present like low urinary tract symptom. Therefore, you should have to consider giving estrogen. Okay, vaginal estrogen creams should be tried ማለት ነው, should be tried, and you have to do urinalysis, and on urinalysis, or you have to consider also, since it's recurrent, you have to consider urine culture, and based on the result you will go for the antibiotic. But you should not forget the vaginal estrogen for such postmenopausal group with recurrent UTI ማለት ነው. Very good. Otherwise, this avoid intercourse is not because she is postmenopausal, but with regard to sexual history, for example, for the previous patient with a 24-year-old, so this is an adult woman. So for the female who comes with urinary tract feature, okay, urinary tract infection suspect ያደረግነት ላይ ሴቶች ላይ we have to always ask sexual history. Okay, sexual history is very important. Because sexual history ላይ አድቫይዝ የምናደርገው it's very important in the future ሪከረንሱን ራሱ ይቀንስልናል ማለት ነው። Okay, it will prevent recurrence. That means ለምሳሌ she have to have urinate. Okay, you have to have urinate immediately after intercourse. ከኢንተርኮርስ በኋላ urinate ማድረግ ይጠበቅባታል። Okay, and also if there is a temporal relationship between the episode of urinary tract infection and the sexual intercourse, there should be also prophylactic antibiotics. Okay, prophylactic antibiotic like ለምሳሌ ciprofloxacin ግማሿን 250 ሚሊግራሟን or 125 ሚሊግራሟን okay ለሶስት ቀን BID ቤዝ መውሰድ ትችላለች ማለት ነው። BID መውሰድ ትችላለች። Okay, prophylactic. So there are a prophylaxis እንሰጣቸዋል for those who are high risk of developing recurrence ላላቸው ሰዎች prophylaxis እንሰጣለን in a daily base or in twice weekly base መስጠት እንችላለን። ግን አንዳንዴ ደግሞ if there is temporal relationship for such kinds of group sexual intercourse with the episode of urinary tract infection, you should have to give it after sexual intercourse. Cipro 250 or 125 milligram for 3 days. For 3 days should be considered ማለት ነው. Good. Okay, number 4. Sorry. So this is an elderly man, 70-year-old man presents with dysuria, okay, wake stream, and nocturia. Urinalysis shows leukocytes and nitrates. No fever or flank pain is present. What is the most appropriate next step? So this is an elderly man. Okay, being man itself is a risk factor. Complicated UTI more and the presentation is dysuria, weak stream, and nocturia. Okay, and on urinalysis it shows leukocyte positive and nitrite positive. So this is a clear sign of urinary tract infection, the lateral side. So this is complicated UTI. This is a case of complicated UTI. No, this is a case of complicated UTI case. So for such kinds of case, was the most appropriate next step? Treat as uncomplicated? No, this is complicated. Being man is also a risk. And refer for prostatectomy? No. No feature of prostatitis or no feature of BPH, but it might be risk. Treat as a complicated urinary tract infection and assess for BPH. Very good. So the BPH might be an underlying structural blockage for urinary tract system. So you should have to assess for BPH. You should have to send ultrasound, pelvic ultrasound to rule out any benign prostatic hyperplasia and rule out ለማድረግ መላክ መቻል ይጠበቅብናል. But for time being, we have to treat it as a complicated urinary tract infection. Okay, complicated urinary tract infection ብለን ማከም አለብን ማለት ነው። So urinary catheterization and discharge? No. This will further aggravate the condition. Start antifungals? No. So you should have to treat it as a complicated UTI. So then you will go for this IV antibiotics for short duration, and you will change it into the pure antibiotic based on the response. Based on the response. Good. Number 5, a 28-year-old woman, 14-week gravid. Now this is a pregnant woman, pregnant lady with a sign and symptom of urinary tract infection. Is asymptomatic actually. In routine urine culture shows greater than 10⁻⁵ colony factor unit per ml E. coli. What is the best next step? Therefore, this patient is a pregnant lady. Okay, a pregnant lady presents with asymptomatic bacteriuria. So significant bacteriuria. No, when we mean bacteria, significant bacteria, which is greater than 10⁵ colony forming unit per ml of urine. So this is significant bacteriuria, but she has no any sign and symptoms since she is pregnant, and this is one of the indication of treatment of asymptomatic bacteriuria. Okay, so the first one, pregnancy. The second one, if there is going to have urologic procedure including catheterization. Okay, and if it's going to have urologic procedures and pregnancy. Okay, and we have also a third one. Okay, so these are an important two causes for treatment of asymptomatic bacteriuria. ማለት ነው። symptomatic bacteria. So she should be treated. The next step, no treatment needed since she is not symptomatic. No. Oral ciprofloxacin is contraindicated for a pregnant lady. So since it has an alternative, then we will go for augmentin. Okay. Alternatives. So alternative drug for cipro or alternative drug for the pregnant lady, we will go for augmentin. 625 milligram PO TID base for up to 3 to 5 days መስጠት እንችላለን. We will consider nitrofurantoin is also good. Okay, nitrofurantoin might be also considered. Okay, 100 milligram PO PID might be also considered. Augmentin, nitrofurantoin, or cotrimoxazole, again if there is a lower risk of resistance in less than 20% ባለበት ሰዎች ላይ ኮትሪም ኮንሲደር ማድረግ እንችላለን። or we will consider also cefixime. cefixime consider ማድረግ እንችላለን ማለት ነው። cefixime consider ማድረግ እንችላለን። So oral ciprofloxacin is not. Oral nitrofurantoin could be considered. Delay treatment antisurgery? No, because it will induce. If it's not treated, it will cause preterm labor, immediate IV antibiotics. No, this is actually uncomplicated case, but she can tolerate PO, so you will go for oral nitrofurantoin. Good. Number 5. Okay, now this is a 7-month-old male infant. So it is brought to ED by his mother due to fever for the past 3 days. He is irritable and has decreased feeding. He has no cough, diarrhea, vomiting. There is no rash or ear discharge. His temperature is 39.2. He is febrile. Exam is febrile and fuzzy but consolable. Physical examination is otherwise unremarkable, and urinalysis catheter sample shows leukocytosis positive, nitrate positive, WBC numerous, bacteria seen. What is the most appropriate next step in the management of this patient? So in this case, A, start oral amoxicillin and discharge. Start IV ceftriaxone and admit, reassure and follow up in 48 hours and repeat analysis in a clinical. So this is an infant, okay, an infant, male infant with signs and symptoms of urinary tract infection, confirmed with signs and symptoms as well as with investigation ማለት ነው. So for those infants less than 1 year, being male is an important risk factor itself. Okay, an important risk factor itself. But for those who are less than 5 years and women, okay, particularly women, again, this is a risk factor itself. ማለት ነው. Okay. One is due to a hygiene problem. Okay, one is due to hygiene problem. Hygiene problem is an important cause. Okay, በተለይ ዳይፐር ሲጸዳዱ ስቂጣቸውን ሲያጥቡ ከአናል ኤሪያ ወደ ፊት ለፊት ልጆች ላይ ሴት ልጆች ላይ ከአናል ኤሪያ ወደ ጀስት ፖስትሮ አንቴሪየርሊ ዋይፕ የሚያደርጉ ከሆነ አሳን ኢምፖርታንት ሪስክ እሱን አድቫይዝ ማድረግ ያስፈልጋል። ሶ ኤኒዌይስ ዲስ ኢንፋንት less than 1 year should be treated as a complicated one. Okay, so he need an IV antibiotic. IV ceftriaxone, and he should be admitted ማለት ነው. Otherwise for those children's adolescents from 2 to 8 years and others adolescent children's, you can treat with PO antibiotics. Okay, you can consider PO antibiotics, and the first line being is Cotri. Okay, cotrimoxazole. መጀመሪያ you have to assess for any history of allergy. cotrimoxazole 240 mg BID base for 5 days should be tried. Okay, should be tried. መሰጠት አለበት። Otherwise we will consider augmentin as well. We will consider augmentin, okay, in the form of 312.5 mg per 5 ml አድርገን as a BID base or as a TID base for 5 days መስጠት እንችላለን። or we will try ciprofloxacin. አንዳንዴ ciprofloxacin lower dose በ10 mg per kg አድርገን for 3 days መስጠት እንችላለን። short duration ነው ያለበት because they are growing children. So since ciprofloxacin they are okay, they act on, okay, they act within the nucleus. Okay, they may inhibit the growth of the cells in the children. So we should it's better to avoid it, but if it is a must, we should only give for short duration. ማለት ነው. So this is all about for today. Thank you.